Good afternoon, Victoria County. At this time, we have no new cases of COVID-19 in Victoria County. I would like to remind you all that this is live streaming on KView and Magic 95.9 right now over the air. And for any local information for COVID-19, please visit victoriatxoem.org or our hotline at 361-580-5796. Today we have Dr. McNeil, our local health authority, with some information on the confirmed cases we have, and Lane Johnson, the Chief Clinical Officer with Gulf Bend Center, for some mental health and self-care tips during this time of COVID-19. I'll now turn it over to Dr. McNeil.
Thank you. Thank you very much. Okay, I have just a few things, and they come up with these press briefings for us, and they kind of give us an idea of what we're going to talk about. And these are based on questions that people have. And so the first thing I, of course, want to talk about is the community exposure at the Sprint store and at the Lone Max store. And that's been in the media, and we all know about that. Basically, we're going to talk about what the epidemiologists do. And these are the people that do the research for the health department. And they're the ones that go through these cases individually, and they look at everything that happens. And they do it in a way so that we're able to come up with a conclusion as to if this was community transmission or if this was a specific case that we can contain. The whole idea, as I've said from the very beginning, is that we need to contain this virus, and we do this through information. So we get this information, and these are very tedious examinations, and I'll talk about the steps in that in just a few minutes. But for the most part, I want you to know that after the epidemiological investigation done here, on these specific cases, we've determined that they are at low risk. So what does that mean? What does low risk mean? Well, first off, it means you don't have to be isolated, okay? And you'll notice I didn't say the word quarantined. We try and avoid the word quarantine because people can isolate themselves, and the whole idea is just to keep the virus away from the public, and that's what people do when they isolate themselves. So when we look at this, I have a thing in my hand, and this is pretty much what I can call the one-page Bible that tells us exactly what the risks are. And this is based on information from the Centers for Disease Control, the World Health Organization, and the Department of State Health Services here in Texas. So they're all in agreement, and so we're going to be in agreement here in Victoria County as well. Now, as far as low risk by definition is being in the same indoor environment, classroom, emergency department, waiting room, a bar or a restaurant, with a symptomatic case for a prolonged period of time. Somebody's going to ask, what's a prolonged period of time? By definition, it's 10 minutes, okay? Let's go with that. So I can see John nodding already because he was going to ask that question. So 10 minutes for that as far as a prolonged period of time. Now, when you look at that, you say, what's important about that? Well, the thing that's important about that is the word symptomatic. This is a patient that has symptoms of COVID. In other words, they have fever, they have cough, they have shortness of breath. This is a person that is symptomatic, and when they are symptomatic, they have the possibility of spreading the virus. Pretty much all the organizations agree that the majority of this spread, the overwhelming majority of transmission of this virus, is done during the symptomatic period. In other words, when the patient is sick. So one of the questions that I answer when I get a call from another physician or any patient, and they ask, I was around this guy, and he was around someone that had COVID, we think. My first question is, were you around a symptomatic patient? And when they say, no, but I was around somebody that was around somebody that was symptomatic, then I say, you're low risk. And they say, well, what does that mean? And then I look at my little thing over here, but I already know it, and it means that you need to just observe yourself for symptoms. So the take-home message here is that if you have a low risk, in other words, you were just around somebody that was around somebody that either had it or might have had it, then that is a low-risk exposure, and that means you self-monitor and you just basically watch yourself for the development of symptoms. Now, if you develop a fever, if you develop a cough, if you develop any symptoms whatsoever, then of course there's a possibility of COVID. Now, has that borne out in all the testing that we've done? No. In the health department, I can tell you, and everybody always asks a number, so I can tell you that we've tested personally at the health department at least 100 plus patients, and they've all been negative. And we don't test people unless they are at risk. So We've tested the ones that we thought had the possibility of having the disease, and they were all negative. Now, we do have 3 positives in Victoria, we know that, and these were all patients that were tested through the private sector. The private entities are testing people left and right. So, and that's good. We encourage that, we want that. I have no idea how many tests have been done. No one in the health department has an idea. But we are testing patients aggressively, and we're testing more and more patients every day. Okay. So that should pretty much do this. Now, as far as medium risk, that's a person that was within 6 feet of a symptomatic person for a prolonged period of time. In other words, the example that the epidemiologist just gave me a few minutes ago was that you went to dinner with someone that had symptoms. Say you went to dinner with someone and your buddy was coughing, and you sat there with him for greater than 10 minutes while he was coughing. You're at medium risk because you had exposure to someone like that. Now, if you develop symptoms, then you certainly you go up the ladder and you get tested. And that's the thing. When we talk about testing, everybody always asks, why don't you just test everybody? Well, first off, we're not going to do that. We're getting more and more testing capability. The last few times I've told you this, I've said, well, we don't have the capability of testing everybody, and we probably still don't. But we have a lot more capability than we did a few days ago. So a lot more people are being tested. So we will test you if needed. And if you develop any symptoms whatsoever, then you will immediately be tested, okay? Now, the Centers for Disease Control, there's actually a rule set out by the CDC and the Food and Drug Administration that prohibits testing of asymptomatic people. They don't want asymptomatic people tested. So here's the deal. You go out one day and you go to a place where there's been COVID, and then you call your health department and say, I want to be tested. And we say, do you have symptoms? And they say, no, but I was around people that could have had symptoms. Well, we're going to say we're not going to test you, and there's good reason, there's good science behind that. And the good science behind that is that you will probably be negative. We know that because you're not showing any symptoms. You're not shedding the virus, you're probably not going to show any symptoms, and your test is going to be negative. 3 days from then, you develop symptoms. And you say, well, I've already been tested, I don't have it. That's a false negative because you may have the disease, and we've already tested you, and now you're under the impression that you're negative. So it's actually dangerous to do false negative tests. We test patients when they're symptomatic, and that's what we do. Okay, that's one of the explanations, and I'm just trying to make that clear for everyone else. One of the other questions that was brought out, why don't we quarantine everyone? Well, good question. First off, we don't quarantine people. We isolate them right now. The greatest risk of exposure is when someone is actively having symptoms with prolonged exposure. So if you're exposed to someone that has the disease, and you're showing symptoms, we're going to test you. But we're also going to isolate you, and we're going to watch you for 14 days for the development of the disease. So 14 days is the day. That's the number. And that's been the number that's been shown that we can catch the virus. If you're negative and you're asymptomatic at 14 days, then you're presumed to not have the illness. So basically there's no need to quarantine or isolate people other than to just observe them for symptoms. If they have a low risk exposure and they have not been ill themselves and they're asymptomatic, then those people can basically monitor themselves, and that's what we're doing. So when we don't quarantine someone, it's because we're having them monitor themselves for symptoms. Now, if they develop symptoms, what do we ask them to do? We ask them to isolate themselves, contact us so that we can arrange for testing, okay? And we can arrange for testing. We can get that done. One of the other things that they wanted to mention is that, and this has been questioned, can you spread the virus while non-symptomatic? Okay, that's a great question. And the answer is simple. Well, it's not that simple. But the answer is this, is that all the research that we've done shows that the overwhelming majority, the major preponderance of all people that transmit this disease have symptoms. Now, can I sit here and tell you that without symptoms you can't transmit it? I can't say that because I don't know. But the Centers for Disease Control doesn't know, and the World Health Organization doesn't know. So I don't feel bad about not knowing that answer. But I can tell you this, that we do know that the research shows that this disease is transmitted through droplet therapy, through people that are spreading the virus because they're coughing, and they're coughing because they're sick, and they probably have fever. So that's another reason, that's the first question we ask when someone says they think they've been exposed to COVID and needs testing. Okay. Okay, why are people told to stay at home for 14 days and not being tested? I think I've explained that. Because basically we're watching them for the development of symptoms for two reasons. One, if they develop symptoms, they need to be tested because they may have the disease. The second thing is that the yield on the test will be much higher for us. It could be a false negative. In other words, we test you, the test is negative, but you have the disease because we tested you too early. So we will wait till you have symptoms, and that's the way that works. I think we're going to have questions in a little bit, and I'll go back to you.
Okay, perfect. We're going to turn it over to Lane Johnson with Gulf Bend Center to give us some tips on mental health during this time.
Thank you. Good afternoon. First of all, breathe. Just breathe. Second thing you do is you smile. We got to keep smiling. There's a lot of anxiety right now, and of course there is. There's a lot we don't know, and the less we know, the more afraid we are and the more anxious we are. We cannot not be anxious, but we can manage the anxiety we have by focusing on what we control rather than what we don't control. When we start looking at all of these things that are happening that are dangerous to us and we can't control them, then we get very scared, we get frightened. But if we focus on the things we can control, how do I take care of myself? How do I breathe? How do I keep a sense of humor? How do I smile? How do I eat right? How do I relax? How do I exercise correctly? And how do I connect with people? We're social distancing, not social disconnecting. We can stay connected with people. We have the technology to connect in so many different ways. So email, text, start email strings with your family. Write letters to each other. Letters that don't finish the sentence, where someone else has to pick it up and build it. Write a book, for heaven's sake, with all of this social connection. Another thing that's important is we want to stay informed. We want to watch the news. If we fear we're missing information, we get anxious. But at some point, we have to take breaks from the news, because if that's all we listen to, we are deluging ourselves with what I do not control. Take some breaks. I recommend 15-minute breaks at the least to get away from. Turn off the news, turn off the phone, and just relax. Walk around the house, get outdoors, do some breathing, do some relaxation. Rely on music. Let music calm you down. Make a list of some of the favorite things that you like to do indoors. If we're confining ourselves to home and we're not out and about like we used to, this is a time to be creative, not a time to fret about what I cannot do, but a time to use my imagination, to be creative about all of those things I used to figure out how to do when I was a kid by just stepping outside and being curious and being imaginative. These are the kinds of things that we can revisit and reclaim in our life in this stressful time. And then finally, let us be aware that I've learned that we Americans, and certainly we Texans, are at our best when things are at its worst. So let's let that happen. Particularly have some compassion for all of us. Have compassion for people who are symptomatic or who are at home. These folks are not the enemies. These are patients. They didn't do this on purpose. And let's be mindful of that. Let's leave them alone and let them heal, or send them a get well card rather than questions about things. Let's stay connected, and let's stay compassionate with each other, and let's smile. Just smile. Thank you.
Thank you, Lane. I remember when 9/11 happened, I heard a Mr. Rogers quote for the first time that said, "When you see scary things, look for the helpers. You'll always find helpers." And I find it interesting that right now helping looks so different, because it looks like staying at home. It looks like calling your neighbor or your grandma and checking in on each other. And I really appreciate you being here to speak to some of those things. And we'll open it up for questions now if we have any.
Yes, I was wanted to ask about whether or not food handlers should be wearing gloves and masks, and do you have a recommendation for that, Dr. Johnson?
You know, I'm not exactly sure what the health department, this would be the great time for David to be here. as far as that specific recommendation. We always recommend that they wear gloves and they need to wear hairnets. I know that that's part of the food safety code. But as far as masks, we really have not recommended the general public wearing masks. But once again, that goes back to the symptomatic versus non-symptomatic or asymptomatic. Any person that's sick certainly should not be around anyone, much less the food supply.
Go ahead.
So, are different blood types more vulnerable to the coronavirus than others? We've heard reports that, for example, A negative is more susceptible than O negative.
That's interesting. I have not heard anything about that. I don't know if any one specific blood type. I'm not sure that we have enough data out there to really come up with a conclusive answer on that. And that just goes to show you we're going to learn a lot of things about this virus after it's over. And we'll certainly have better numbers, and we'll have better percentages of what happened to what classes or age groups of people. And we'll also probably have information on what happened to specific blood types. There'll be a lot of post-event monitoring done after this.
And yeah, we've been getting a lot of questions about testing, and I wanted to ask about this. The fact that these 3 cases were found through private tests, do you think that indicates that we're not doing enough testing through the public health center, or just in general?
Well, in the beginning, we were the only ones that were doing the testing, and that's just a statewide thing. It's a nationwide thing. We were kind of caught surprised by the fact that this happened, and we didn't have specific testing available for it. So everybody did what they could in the beginning, and certainly the more tests you do, but you would think that out of the 100 that we did, that we would have found at least one, but I'm glad we didn't. But for the most part, we encourage every testing that we can, but I don't think it's any reflection on the number of tests that anyone has done.
Because we haven't seen an increase in the last few days, do you feel like the worst is over? How do you feel?
Can you repeat the question?
Yeah, I just remember that. I'm going to repeat the question now.
Sure.
So the question is, basically, now that we have not had any positives in the last few days, do I feel like the worst is over? This goes into an opinion of mine. I look at the curves and I look at the progression of this disease in other areas, and I have really no reason to think that the worst is over, because it's still progressing in other areas. And I believe in that curve. I don't know how high that curve is going to go in our area. I hope that it stays pretty flat, but I think that we would lull ourselves into a false sense of safety if we thought that this was over. I think that there will probably be more positive tests. I'll go out there and say that. I hope that there aren't, but as testing increases, we will find more of the disease, and there will be more work for the epidemiologists to figure out where it came from and stop it from going anywhere else.
I wanted to ask about the contagiousness of this virus and the current restrictions that we do have in place. I thought what you said about how contagious this virus is compared to the flu yesterday was really fascinating and a little bit alarming. And I wanted to ask, given that fact, what you said about how much more contagious it is than the flu, and the fact that it's likely already spreading within our community, wouldn't it make sense then to have much more restrictive restrictions in our community and ask people to stay in their homes and only leave for very essential activities?
Well, that's pretty much what we have been asking, and I'll ask people again to please not leave their homes unless they need to. And we've done that as far as basically just getting people to restrict their motions or their activities. And I think a lot of people have done that. I think that every day that we go by without another positive case, people are going to just instinctively believe that this disease is maybe not as bad as we thought. I don't know what the answer to that is. I hope that the disease goes away. I hope that the virus goes away, but we have to be ever vigilant. And remember, the only thing we have is to isolate. And the worst thing that could happen is for people to start to believe that this virus is not here and that it's safe to go out and do things. And we certainly don't want that, because there could be a resurgence. And it's just going to take time. Only time is going to tell us exactly what the best mode would have been. Right now, we have meetings every morning and we discuss mandatory things to keep people inside. And they ask me, and my opinion is that we're not really at that point, because we have mild community transmission. When we hit moderate to severe, then I think that that would be very appropriate.
If I could do a follow-up question, I think a lot of people are wondering exactly how we're defining that moderate and mild and severe spreading.
The question is, how do we define mild to moderate transmission and spread? There's not a specific number. I can't say if we have 12 cases tomorrow that that's moderate, but it would depend on the epidemiological studies, and these are quite intense. I mean, Brittany and the epidemiology people in the health department, they go through the history of where these patients have been. They actually look at their phone records. They ask them to show us where they've been. They look at bank records. Did you go to the bank? Where did you go buy food? Who did you talk to? They are, I mean, it takes hours to figure all this out. Now, if we start doing these tests, John, and we find out that this person went to 12 different places and was there for 10 or 15 minutes each time and had a cough, then we're going to have to notify a bunch of different places. And that idea is to stop that spread, of course. So we're going to continue to do those epidemiological studies and keep saying, but it's hard to say what's going to, basically, if I had to answer that question quickly, like you probably want me to, I would say we'll know when it happens, because we'll start to see an uptick in it, and we'll start to see, based on this epidemiological studies, that this is where that person went and this is where we found the disease. So we know that it was spread there.
Dr. McNeil, with that logic, would you encourage residents of Victoria from traveling out of town just to protect the community? If so far the confirmed cases that have prevalent in our area are travel related, would you encourage someone to not go out of town?
The question is, would I encourage people to not travel out of town, especially to a place where the virus is more prevalent? And the virus is more prevalent in Houston, it's more prevalent in San Antonio, and I think it's more prevalent in Corpus Christi. So we're starting to see it more around the region, and I would absolutely encourage people not to travel. I would encourage people to stay home. I would encourage people to not have big family gatherings. I would encourage people, just like the government said, to not have groups of more than 10 people together. I would encourage people to stay away from other people. That's what I would encourage.
Are you as optimistic as the president is about Easter being the day that we can all go back to church and social gatherings? Do you think it could be that soon?
Well, you know, you have to look at the curve, and I always go back to that curve. And when we think about the curve, they're talking about a curve in New York City and in Washington. Our cases didn't develop until after their cases did. So we are further along in the curve than they are. They may have reached their peak, or they may be getting close to reaching their peak. I'm not sure that we have. So, and that's been one of the big problems about having a big nationwide order.
Right.
Because it's certainly different in South Texas as compared to
New York has decreased, I think, almost by double because of they're accrediting that to quarantine
Right.
measures, which
Right.
we're saying is too aggressive for our population.
Right.
But I mean, if the results are showing a reduction in cases, wouldn't that mean that it works to quarantine?
The question is, basically, if it works up there, why wouldn't it work down here? I think it would work down here, because I think it's the only thing that will work. And I think that when we get to that point, that's what we will do. I just don't think that we've gotten to that point, and nobody can say for sure that we will. Now, we have strived to be proactive, and we have been proactive from the get-go in this deal. But I really believe that any further spread or any confirmed moderate community transmission would require some type of order. And that's something that the judge and the mayor take very seriously, and it's an order that they would have to come up with. And I'm not trying to just pass the buck to them, because they're excellent leaders. But the thing is that if that happens, then I know that our team will not hesitate to make those orders, and we will do it in the interest of public safety and health.
What are you and your colleagues seeing the most right now within the community? And as so far as levels of mental health or concerns?
We're certainly seeing a rise in anxiety. People have a lot of questions, but we're also seeing that if we keep dialogues open and just field those questions, even if the answer is, I don't know, but we're in it together, then it balances that anxiety. So we're not getting rid of it, but we can seem to sort of tamp it down. Another thing I'm seeing, which is really quite pleasant, is that people are rediscovering ways to entertain themselves and are having a lot of fun with that. So there's some hidden payoffs to this, and that's what I want us to focus on, is where can we benefit from these worst things that happen? And it certainly doesn't justify them, but there are ways to turn it into a good. I'm also seeing, and I'm surprised, and finally, that while people are nervous and worried, for the most part, I'm seeing people are being quite cordial. And others may be experiencing differently, but I'm seeing a lot of politeness and cordiality, and let's just excuse people for stumbling or whatever.
Thank you very much for that.
What advice, Mr. Johnson, would you have for people who just feel like they can't take it anymore, I guess, or they feel like something might break in them, or they just reached a point where they feel like they can't help themselves?
And that's a real place to be sometimes, and I would certainly strongly urge them to have available to them someone that they can call and connect with. There are some hotline numbers that are around. I know there's a hotline number for mental health concerns about COVID. I would call those hotlines. These are trained individuals who are there 24 hours a day to talk people through. I certainly would urge people to prepare for that, to have their own network, to have their family, have their friends, and do not go through that period alone and try to hold it together. And do not judge yourself negatively. We're human beings, we have our limits, and if you hit it, get someone connected with you to help walk you through it.
And Dr. McNeil, I wanted to ask you, can you tell us what a presumptive test is, and whether or not we're reporting those here in Victoria County? I know some people have seen those reported in nearby counties or other counties.
A presumptive test, I mean, a presumptive test in medicine means to me that we presume that it's positive, but it has not been confirmed. That's what I would think. I mean, as far as the epidemiological, I can check on that with Brittany, but that's my understanding of a presumptive test.
Is that something that we're reporting in Victoria County, results from those presumptive tests?
Yes, it is.
Yes, it is.
I have a question from a viewer, and I know you've been asked this many times, but could you distinguish the difference between allergy symptoms and COVID-19 symptoms?
The question is the difference between allergy symptoms and COVID-19. In my experience, the majority of allergies don't cause fever, so that is one thing I would start to think less of allergy and more of infection with fever. Typically, I mean, you know, that's the problem. You can have a cough and congestion, and you can have a sore throat, and you can have posterior nasal drainage, and you can have a lot of these symptoms. You can even have body aches and feel kind of blah just from having seasonal allergies. We see it every day in the clinic. So it's somewhat hard. I guess fever would be my biggest differentiation. But most people know when they have allergies because it's a chronic symptom. If you suddenly develop allergies today and you've never had allergies before, I would be a little suspicious. But the chronicity would be something I would look at in detail.
And are there any other presumptive cases in Victoria County? We've received just, I wouldn't want to repeat them again, but just tips of there being cases.
I know of no other presumptive cases. I know of the 3 positive that we have, and those were the ones we reported to you initially this week.
Yesterday, you released the 2 locations that might have potential risk for COVID exposure. Can you tell us which of our 3 patients, without revealing their names, visited those locations, if they did?
It's fine. I'm not sure exactly. I really don't have that data, and I'm not sure they would even release it as far as epidemiological studies. All I can tell you is that after the extensive study done by the epidemiologists here in Victoria, that those areas and those patients and the people that visited that place were all deemed to be at low risk. So that means to me that the exposure was not significant. So they are deemed low risk.
And I'd also love to hear what sort of basic identifying information you can tell that you can release about confirmed patients, without revealing their names and not violating HIPAA laws. What sort of information can you tell us, like their age or their city of residence, or?
I don't have, to be honest with you, I don't get a lot of that data. I just get that they were positive and where they went, and then they do the epidemiological studies. I really don't know. I know that I'm told they were in their 20s and 30s. I can tell you that. That's all I really know.
Would that information be something that the public health department could release?
That would be on their rules. I'll find out what their guidelines are as far as release and what considers HIPAA.
If we do enter a moderate or severe phase of COVID-19 cases, do we have enough ventilators? And how many ventilators do we have in Victoria?
The question is, if we were to reach a moderate to severe transmission stage, do we have enough ventilators in Victoria? We have approximately 30 ICU beds, and I'm not sure if we have a ventilator for every one of those beds, but I do know that right now the supply is very adequate.
And do you know if any of our local plants or manufacturing industries are planning on making ventilators or assisting in any way? What have the communications been with them?
I don't have any information as far as the local plants. I'm not sure. I don't think that there are any local facilities that manufacture mechanical ventilation devices.
I know that some municipalities have ordered their residents to not even go outside for jogging or outdoor exercise. Any recommendations about that you give to people here?
I think that goes along with what Mr. Johnson was saying. I think people should go outside. It's absolutely safe to go outside and to exercise. And now, don't go outside in a group, but you can certainly go outside and exercise. And I drove by yesterday and I saw one of the gyms here in town had moved their people outside, and they were doing workouts outside. And I think that's a wonderful thing. They're about 15, 20 feet away from each other. I thought that was really good. But I mean, that's what I'm saying. Isolate yourself, but you can still go outside. Please don't isolate yourself in the house this whole time. You'll end up talking to Lane Johnson over there. So.
And it sounds like you're saying too, there's a little bit of less risk of transmission when you're outside.
Very little risk, very little risk, as long as you're not around. Remember, this is a 6-foot deal. We're talking about this being spread by droplet theory when somebody coughs on you. So if there's no one around you, then you're certainly safe. I have no problem with being outside. I have no problem being outside in public as long as you're not around a bunch of different people. I encourage my family to go outside.
We have time for 2 more questions.
I know you've already said that you think people are already doing a great job of deciding when to stay home and what sort of activities they should do, but we're getting a lot of questions about whether it's okay to go into like a shop or like a non-essential kind of a store, or to the mall like Carolina said yesterday. Any recommendations about that kind of stuff? Like, do you think it would be safe to? Do you think it would be a good idea to go to your favorite shop or whatever?
The question is it safe to go to your favorite shop, or specifically to go to the mall or something like that? We've asked people to basically stay home as much as possible. This is not a long-term thing. We're just asking people to restrict their activities. This is hard on everyone. We know that it's hard to say, don't go to the mall, or don't go here, or don't go there. It has a lot of implications as far as the local businesses. It has a lot of implications probably for your psychiatric health. It probably has a lot of implications for other things that I can't even think of. But I can tell you the implications of spreading this illness, and that's my job, and that's the way I approach it. So my recommendation is that unless it's essential, please try and isolate yourself. Please try and stay away from other people. It's just for a short period of time, but this is a critical period of time because, especially in Victoria, because we've already noted mild community transmission, and we don't want that turning into even moderate community transmission, because then it will be time that we have to restrict movements, and we don't want that to happen. And I don't want the disease to spread, because I don't want it to overwhelm our healthcare system, and I don't want people to get sick, and we certainly don't want anybody to die.
I do have a question, which is, if you've established where these individuals have been in the community, you've pinpointed the location in which they've traveled, are the people that work in those locations or who had direct contact, have they currently been tested for COVID? Or is it that they're not showing signs so that you're only simply monitoring at this time, and are they isolated?
Well, that's a good question. The question is basically, what have we done from an epidemiological standpoint to the people that were at either the Lone Max or the Sprint store?
Sure.
So that would be the question. And that's based on the information that I just gave you. I mean, these are patients that were in the same indoor environment, the classroom and the deal. Basically, to get straight to it, they're all observing themselves.
Okay.
And they're watching for any symptoms. They know that if they have any symptoms that they should isolate immediately, and they will be tested because they did have exposure to a known COVID case. But when they're asymptomatic, we're still not going to test them because their exposure was deemed by the epidemiological study to be low, at low
And
risk.
that's what I was,
Yes, ma'am.
hoping to get to, is that we're not.
Yes,
doing
ma'am. They're at low
that.
risk, and we want everybody to be at low risk.
Okay.
And I'm sorry, I just have one more really important question. Can you tell us more about these studies that are being conducted by, I guess, our investigative team with the health department and what we can expect to accomplish with that?
Okay. Well, what you're talking about is contact tracing, okay? And I have the direct information here from the Public Health Department. And basically, when a case is identified, then an intensive investigation into any positive case for 14 days or greater from the first day of symptom onset. That's when the clock starts for the 14 days, the beginning of any symptoms. That means that where did they go, who did they go with, how long were they there, how did they get there, where else did they go, anyone they came in contact with. All these things are they're completely investigated, and all that information is put together. From there, the investigation phase goes into the assessment phase. At the assessment phase, we risk stratify all these patients. So we look at these patients and we decide, are they low risk, medium risk, are they high risk? If they're high risk, then of course, if that's a person, say for example, any household contacts with those people are high risk. Those people are immediately isolated and they have what's known as active monitoring. In other words, they're monitored by the health department and themselves. The patients that had moderate risk, and these are people that were, say, sitting within 6 feet of them while they were symptomatic. Okay, these people monitor themselves, and we ask them to self-isolate if possible. So you can see the difference as we go down. And then the low-risk patients, these would be the ones that just walked into the place during that time, didn't really have contact with them. They were in the same building as the COVID patient, but they left. These are low-risk patients. We ask them to self-monitor. We don't require that they isolate themselves unless they develop any symptoms. So that's in the assessment phase. After that, there's an active monitoring phase, and we monitor these patients for 14 days. So there's a big set protocol for this. It's very comprehensive. It's very thorough, and it's designed for one thing, because this to me, in public health, and as far as the disease goes, is where the rubber hits the road. And the job that the epidemiologists do, give us the information of where to look for and how to stop the spread of this disease, and that's what it's about.
It sounds like you're saying we're learning things from these studies real time in the moment.
Well, I tell you what, we're following set protocols that we would do in any contagious disease or any infectious disease that has the capability of spread. But what we're learning is that this disease is in a lot of places. It's pandemic, and it's capable of killing people. We're not sure exactly what that case fatality rate is, but we're investigating it.
Dr. Johnson, just one last question. To parents with children at home who are wondering when they're going to get back to school, back to their routines, what advice would you give them to provide some sort of solace and peace to their children during this very anxious time?
So the question was, what advice would you give to parents with children at home right now with a lot of uncertainty going on?
Well, first of all, don't tell the children something that you don't know to be true. If it's uncertain, say, nobody really knows. It'll be over when it's over. In the meantime, here's what we're going to do, and have activities for the children. Get outdoors in the backyard or front yard, but just come up with things that the kids can do, games that they can play. Pull out all the board games, pull out the cards, and be a family. Have a good time, but assure these children over and over that these things happen from time to time, and we'll get through it. We always do. And you're not alone, and you're loved, and you're being taken care of, and that's one thing that hasn't changed.
Thank you very much, and thank you everyone for tuning in today. I just wanted to remind everybody that for accurate information, if it's released on our Victoria County Public Health Department Facebook page or put on our website, victoriatxoem.org. It's accurate information coming directly from your local officials. Excuse me. And our COVID-19 hotline is 361-580-5796. Again, that is 361-580-5796. Those hours are Monday through Friday from 8 to noon and 1 to 5. And I encourage you guys, if you have any COVID-related questions, please call in. Tonight, it'll be on Sudden Link at 9 p.m. And following the closing of this briefing, it'll also be aired on Q92, Jack FM, Club, and Kick stations. And I also wanted to especially thank Lamar Advertising for putting all this information out on their signs around town so people who don't have access to internet are able to access this information. For anyone with unmet needs such as food or rent assistance, please call 211. And the Harris Center has activated a 24/7 mental health call line to support our community during COVID-19. The purpose for this line is to provide trauma-informed support and psychological first aid to those experiencing any stress and anxiety related to COVID-19. So that hotline number is 833-251-7544. I'll repeat it one time, 833-251-7544. Thank you all for your time, and we'll see you again tomorrow.